Hey folks, this is Dr. Timothy Lineski with Lake Cumberland Rheumatology, coming to you from the great state of Kentucky. I-75 heading towards Louisville, up past Lexington. Have the Kentuckiana Rheumatology Alliance meeting. But I wanted to talk to you a little bit today about exercises in arthritis. A lot of my patients ask questions as in, what are the best exercise programs to do? So I thought I'd talk to you a little bit about some of the ones I recommend. Number one is yoga. Most of my patients, if they have severe arthritis, I tell them to buy a yoga DVD. It could be for beginners, depending on where you are in your range. I actually do a yoga program called PIO, which has Pilates and yoga together. And what you want to do is, if you're somebody who has never exercised, you want to start with 5 minutes, 5 days a week. And then each week you want to increase by 5 minutes until you're at a 30-minute exercise every day of the week. Tell yourself you're going to do it every day, because if you say every day, then you will do it 5 days a week. You tell yourself 5 days a week, you'll do it 3. Tell yourself 3, you'll do it 1. Yoga is good because yoga is low impact, as are the rest of the exercises I talked to you about. You want to look at something that causes you to sweat, causes you to increase your heart rate, strengthens your muscles and balance, and but is low impact. Yoga is by far, maybe not by far, but definitely number one on my list. Number two is Pilates. Pilates is more of a movement, strengthening, but again, low impact when it comes to people with arthritis, especially in the hips and knees, or rheumatoid arthritis patients with joint pain in various regions. After yoga, Pilates, Tai Chi is a more gentle exercise and incorporates a lot more, incorporates a lot of balance activities. This is one where if Pilates and yoga are too advanced for you, you would want to start at. There are some very good ones, especially for people over the age of 65 to utilize. So Pilates, yoga, Tai Chi. Then after that, I look at more mechanical things, such as a bicycle or an elliptical machine. Bikes are great because you reduce the impact on your lower extremities. You also can increase the resistance. And again, starting at a low time-wise and low resistance, and building yourself slowly up over the course of 2 to 3 months. Elliptical machines, one little trick I like to tell people is, if you get up to the point where you're on the machine for greater than 10 minutes or so, is to do 5 minutes going forward and challenge yourself and do 5 minutes going backwards. You'll utilize different muscles, especially muscles that we don't typically use, like our hamstrings and some of the gluteal muscles, that when you strengthen them up going forward and backwards, you will improve your balance. So, top 5 exercises to utilize for arthritis patients, according to Dr. Timothy Lineski: yoga, Pilates, Tai Chi, bicycles, and elliptical machines. Hope that was helpful, and have yourself a good day. Check us out on Facebook, Dr. Lineski, our webpage, InsideLCR.com, and everywhere else like Google+. Take care.